Hello everyone, my name is Omar Mustafa and this is speech 100, section 0520. Good morning everyone. Most people enter a drugstore assuming that the pharmacist is only there to hand out prescription drugs. However, pharmacists are some of the most available and overlooked healthcare professionals in the United States. Today, I want to demonstrate to you that expanding pharmacist roles in healthcare would improve access, lower prices, and help improve outcomes for patients across the entire nation. First, to the nation's Association of Chain Drugstores, over 90% of the Americans live within the just 5 miles of a pharmacy location, which means that most communities, especially the disadvantaged ones, a pharmacist is often more nearby than a doctor, office, or hospital. Additionally, a lot of pharmacies are open late at night and on weekends when clinics are not open, making the pharmacy one of the most available medicine professionals in everyday life. Second, increasing the amount of pharmacist positions may significantly reduce healthcare costs. I just fucked it up. Increasing the amount of pharmacist positions may significantly reduce healthcare costs. According to the Centers for Disease Control and Prevent (CDC), drug abuse costs the U.S. healthcare system as much as $300 billion per year. This takes place when the patients do not take their drugs and prescriptions and do not fully understand what are they being prescribed for. Pharmacists have the ability to address this by offering counsel and as well as medication management, and in fact, research demonstrations that when pharmacy professionals participate in patient care, readmission to hospitals can drop by as much as 30%. Third, pharmacists assist in treating long-term conditions like asthma, diabetes, and high blood pressure, and identifying risk drug interactions every day before they contact a patient. The Washington Post published an article about how increase the numbers of pharmacist support service can improve access in communities. With a lower number of primary care providers, while some could argue that only medicine professionals should make treatment decisions, pharmacists are supporting doctors by overseeing regular drug administration so doctors are able to focus on cases that are more complete. While some might argue that only doctors should make treatment decisions, pharmacists help physicians by administering commonly used drugs so that physicians can concentrate upon challenging circumstances. In conclusion, expanding the role of pharmacists is a realistic and efficient way to improve healthcare in the United States because it improves the safety of patients, increases quality of care, and lowers extends healthcare spending. Since the pharmacists are already in place, our communities, the real issue is